Well, millions of Americans desperately trying to sign up for Obamacare have been faced with glitches and errors for months now. But on Christmas Eve, one mother of 5 was told by a healthcare.gov supervisor that hers was, quote, the worst case of the glitch she has ever seen. And now, instead of having health insurance through Obamacare, Shannon Wendt's family faces massive uncertainty. She joins me live from Grand Rapids, Michigan, to share her story. Shannon, good morning. I wish it were under better conditions that we were speaking. Tell us how you found out that you were not covered anymore by your plan. You thought you were and you had a plan you liked, right?
Right, yeah, we've purchased our own insurance for years. My husband is a real estate agent, so he's considered self-employed. We heard some friends about who have a similar policy to ours. They were talking about how their plan was being canceled and the trouble that they've been having with the healthcare.gov site. And at first I kind of thought like, oh, I'm glad that doesn't apply to us. But then just talking with them some more got me wondering maybe I need to double check and make sure that ours is not being canceled. And when I called and found out ours was being canceled, from there trying to kind of work through that healthcare.gov and just running into glitch after glitch, a dozen different glitches, just trying to fill out the application.
So here, if you like your plan, you could keep your plan. That certainly wasn't the case for you. But every time we hear a plan is being canceled or dropped, that means a family. How many kids do you have?
We have 5.
Yeah, I mean, that's scary, right? Because we're right in the middle of flu season. I read, and tell me if this is true, is your oldest sick right now? Does she have a cold?
She is. Yeah, we've got kind of the respiratory flu, something kind of going through our house. Yeah, hit my oldest.
But right now,
the little kids are getting.
With your plan being canceled in the interim, what's your situation? Do you feel comfortable going to a doctor when one of them is sick? Where are you?
Well, being that we have always purchased our own insurance, we chose to have a low monthly premium and a high deductible. So that meant that all of our kind of sick visits and little, sneezes and scrapes, those kind of things, we've always paid out of pocket. And so even for now, like that really isn't changing for us. We prefer just to kind of stick close to home and try to treat things, as best as we're able to, and kind of reserve the doctor's office for, when things get a little bit more serious, when, my home remedies aren't really cutting it anymore.
Right, because it would be
at this point,
more expensive.
Exactly, yeah, exactly. But for us, that has made financial sense. We've technically, according to Obama, been underinsured, but we've been that way on purpose. To us, it doesn't feel underinsured. We feel like it makes financial sense for us to have a higher deductible plan and just pay these little things out of pocket. And then the money that we've been able to save every month on our premium, we've been putting away for years and years in the event that something comes up, where we would meet our deductible, where we would have some significant medical needs. I heard somebody once kind of explain homeowners insurance as it's there for when something is going to ruin your life, not ruin your day. And we've really taken that same approach to our health care. We want it there when, a big event happens, not just the little scrapes and sneezes.
Sure, and you were managing that on your own. Over the break, which I know you spent on the computer trying to figure this all out, Kathleen Sebelius, the quarterback of this whole thing here, she said she was satisfied, happy with the rollout and how it's going and affecting everybody. What do you say to her?
Oh my gosh, that made me laugh. It's frustrating that she is so out of touch with Americans. I have heard of people who are being helped through the Affordable Care Act, who are able to afford much better insurance than they were ever able to afford before because of the subsidy. But the fact, remains that somebody's paying for that. Nothing is ever free. And we need health care reform. There are people in America who need better health care, better health coverage, and the rising cost of health care isn't really being tackled in the Affordable Care Act, and I think that's one of the biggest issues here. And I'm frustrated that that isn't even being looked at, really.
Shannon Wendt, we wish you and your husband and all 5 kids, a healthy winter season here, and we thank you for being with us, expressing your concerns as a mom.
Thanks.